Hi, everyone. With me today is Bobbi Newman and Bobbi Rogers. They have partnered to shed a light on how COVID has affected our special needs population. Dr. Bobbi Newman is a world-renowned psychologist and behavior analyst, as well as an author of many publications, books such as Move with a Purpose and When Everybody Cares. Bobbi Rogers is a parent advocate, nonprofit founder, and director of Proud Moments Therapy in Syracuse, New York. Today, they will be interviewing Chanie Rubin. Chanie is the Chief Quality Officer, as well as the founder of Proud Moments Therapy. Bobbi Rogers, why don't you take it over from here?
Well, first of all, thank you so much for being here. It's such a busy time for everyone right now. So I appreciate you carving out time to speak with us today. I was really excited to have you on in particular because I think many families struggled immensely with telehealth and remote learning in general. And Proud Moments was very successful at making this work. So I really wanted to talk to you in particular about how you did that. And hopefully there's people who are watching that can really learn from what Proud Moments was able to do. So I guess my first question to that endeavor is to ask you, what do you think really helped make Proud Moments so successful?
So first of all, thank you so much for having me and having me do this interview. Wherever I can help and, really sticking to our mission of being able to help children, whether it's within Proud Moments or outside of Proud Moments. So thank you for that opportunity. So I have a lot of thoughts, to your question, and I think it's definitely multifaceted. But I think just to start is we were really able to utilize our technology platforms very quickly to help pivot us to telehealth, in this crazy COVID environment. And honestly, we really couldn't have rolled it out so quickly and so successfully without our incredible team, Dr. Bobbi Newman, who you have here, and many other individuals within Proud Moments, clinically and operationally. And, I think it's an African saying, it takes a village, and it really took a village. I think it was around mid-March when, everything slowly started closing down. And we realized that closing down for us was never really an option. The offices, the physical office locations may have been closed, but for Proud Moments, it was really our top priority above all else to make sure our clients have continuity of care. Our staff's immediate concern was finding ways to continue providing care to our clients and preventing that loss of skills that they worked on so long and hard to achieve. We all know what it's like. You finally hit mastery, and then to put services on hold, having children regress, it just wasn't an option. So when we made up our mind to say, we're going to figure this out no matter what, it may not be. And I remember Bobbi having these discussions with you early on and saying, it may not be the best solution, but we're going to figure something out. And I'll talk a little bit more about how it evolved, but we knew that we need to do something. So from there, our team worked together to formulate a plan to really keep our clients successful in their programming and making things as easy and non-destructive as possible for the families, for the children we service, really to ensure the safety with everybody involved. We very much knew that we were essential workers and that families and the providers that felt comfortable continuing in-person services, we definitely were okay with that. We sent out, masks even early on. We did gloves, hand sanitizers, the works. And for those families or providers that weren't comfortable, we realized that we still need that continuity of care no matter the environment. And we approached the telehealth option. We really viewed it as the same service, but a different modality. And that mindset allowed us to really be successful. Before I continue, because I can talk about this for a really long time, do you guys have any questions?
Yes, so we definitely do. And I remember those initial conversations, and I remember that, I've made reference to that first big BCBA huddle up that we had as we were moving over to telehealth, and you were making reference to it here, and I've talked about it in some of our other interviews. What impressed me so much about what was happening was other organizations I know were shutting down, were going on hiatus. And I remember, again, I got a little choked up as I was talking, and I said, that isn't us. That's not Proud Moments. That's not what we do. We're going to somehow, again, it may not be as perfect as we have it in our mind, but I think it was Ann Byrne who had the quote that perfect is the enemy of good, or perfect is the enemy of, great even. If it wasn't going to be perfect, that's one thing, but everything that had to be done. I remember there were families that did not have technology, and Proud Moments was busy sending electronics to people. There were families, there were people who still wanted to continue. It was still whether that we could do backyard sessions. We did some backyard sessions in addition to other things. So again, there was just so much coming at everybody all at once. And it's easy for me personally in terms of, if I only had to think about the clinical end of things, that's one thing. But in addition, there were a lot of administrative decisions and a lot of administrative thoughts on your end, interacting with the insurance companies. If you can tell us a little bit about some of that infrastructure that needed to be thought of, decisions that had to be made, interactions with the insurance funders. Can you tell us a little bit about that?
Yes, I definitely can, but I think, Bobbi, ahead of that, I would love to get a little into a little bit of how we educated our providers to pivot so quickly, and then talk about the logistics of how we got it done with the payers and the technology, because it was literally in that order. First, we figured out how are we going to educate our providers. Once we felt comfortable that our providers, our BCBAs, our behavior techs are equipped with the right tools to go into the home, then we picked up the phone, we called those insurance companies, we advocated and fought for those kids, and I'm going to get into how we did that. And then we worked with our operations and admins and IT team to get the ball rolling. So really, and this was not just for our BCBAs, but making sure that our BCBAs, our BTs, our families felt very supportive. We set up a lot of different committees for each group that individually followed and conducted surveys on effectiveness. And that was done like from day one. So if we weren't doing it right, we knew what we weren't doing right and we can change it. And I think that it's important to understand that in this environment, people are scared. They were very scared of the unknown. And Bobbi, I remember early on getting, I think it was like literally a day after we closed our offices, or maybe that night, getting onto like an emergency phone call on how are we educating people. And the more education that we provide, the more comfortable our clients are going to feel, the more confident our providers are going to feel, and we're ultimately going to have better outcomes. So along with the telehealth, actually, I would say, alongside, side by side with the telehealth transition, we also delivered a series of clinical webinars to our BCBAs and behavior technicians, led by Dr. Bobbi Newman and Andrea Cutler and a couple of other individuals who had, and Bobbi, you can probably remind me who it was. I don't remember, it was a while back. Try to block out some parts of that. That time period was crazy. And we really empowered our BCBAs to feel comfortable with the new normal, and not only feeling comfortable, but to be able to coach their behavior techs who can then coach and make their families feel comfortable. And part of our education wasn't only on programming and to have that trickle down effect, but to really make sure that our providers had that level of empathy and understanding that this is not normal, this is not okay. But what Bobbi mentioned earlier, perfect is the enemy of good. And we just got to make sure that our clients are not drowning and are not regressing. And that education was step one. Then it was very important that our families don't feel that telehealth services are generalized and the same for all clients and like cookie cutter. Because we're going to do telehealth, we're going to do this program. And we made sure that our families and our providers felt very comfortable that they can individualize these services with the existing goals and treatment plans, like I said earlier, same treatment, but a different modality. And just adding that personal touch to what that family needs, or really having that empathy and insight into where the struggles are within this environment. So that was very helpful, in getting the parents comfortable, educating our providers. As it relates to our payers, we got onto the phones and coordinated with all of our payer partners, managing the flow of the telehealth coverage so our families don't feel stressed out by it. We took on the full responsibility, making sure we get authorizations. The companies that didn't want to authorize, we just kept calling and fighting. There were times, in March, I was on the phone on hold with a payer from when they opened up until they closed, so we can get it done. I didn't take no from any of them. And this was before everybody allowed telehealth. I would like sidebar with Dr. Bobbi Newman on via email or texting and saying, okay, I have them on the phone. How are we proving that this is medically necessary? How are we getting the authorizations? How are we getting the hours? And we did it. It took time. And I do think that we didn't only do it for Proud Moments. We opened it up to a lot of other organizations and agencies out there that are providing the same kinds of services because of that ongoing education and persistence. We really didn't give up. It was great, and we were successful. Very, very grateful for that.
And hopefully this will be a story that we'll all look back on at some point, and this will be distant history, and we'll think back on it and the lessons that we learned, because I think this has made a fundamental shift that part of what we talked about in some of our other discussions has been, what will be the lasting effects of this. And we've talked about it in terms of people's emotional lives. And I do want to come back to that stress level, but we're also going to be talking about how has this affected service delivery? Now that we've seen that telehealth is such an effective modality for some people, I think it's here to stay. And it will allow us to reach people in communities that we couldn't otherwise reach, where we might not have a physical presence or where BCBAs are not on every block. So I think that the work that was done, and I know, I don't know how you slept or when you slept at those times, because it seemed like you were constantly, in addition to, of course, your family and everything, you were doing this around the clock. So I just do want to kind of touch back on that. There was a stress level for you. There was a stress level for the organization, for the families, for the providers. Again, I have my take on it, but I would love to hear from your perspective, sort of how those stressors for the families, for the staff, for everybody were kind of addressed.
That's a great question. I think the stress level was very high. We were getting used to a new normal. COVID affected everyone. Back to what I said earlier, it's really about empathy and realizing that we understand what you're going through as families, and we're going through something similar at home. And really making sure that our families and our providers feel supported, not overwhelmed in any way, and making sure that we prioritize our personal and professional life appropriately, and making sure our families and our providers knew that we were on the same page as them, is really where it was at. And, we all covered for each other. We supported each other. We were a team. And like I always say, we're the Proud Moments family. And that's really what shines through, with all of the COVID stresses.
And moving ahead, the vaccines started last week. Again, for taking this out of context time as people are watching this over the course of time. Some people will be watching this a bit in the future and will have the benefit of hindsight. But where do you see all of this going now with continuing telehealth? We've been back in the homes for weeks now. In addition, of course, we have to shut down at particular times, and particular families, particular providers have tested positive. We've had to go in and out of quarantine for some families, some providers, some micro clusters, as they've called it in the city. So again, some people will be watching this kind of in hindsight, but we're living it now. So as we move ahead, telehealth and service provision. Do you see this as something that we're going to continue with as an option for providers and families?
I think it's a great question, and it's a very talked about topic. I think telehealth is here to stay. I don't think it's here to stay for every code set or is sufficient for all types of services, but it's going to allow us to provide services in the more rural areas where we can't typically get BCBAs. So I think that's a great thing. It's going to allow us to provide services when a family is sick, whether it's with COVID or something else, and continue that continuity of care, whether they're on vacation or if there's a snowstorm. I know you guys in Syracuse, Bobbi Rogers, have snowstorms all the time. So if we can continue that continuity of care and work on those same goals, I mean, then telehealth is a great thing. I think it's important for us as providers to document our outcomes and our successes. I mean, ABA is all about data, and having data to prove that what we're doing is successful is going to be the tools we need to continue these kinds of services. Probably shouldn't say this in an interview, but my personal thoughts on providing direct care with telehealth, is it great? No. Is it a good option? If there's nothing else, then definitely. And I probably should not have said that out loud, but I just did. I hope I don't get penalized for that in a public interview. But you know, it's obviously not everything is better in person. But for those BCBA services, whether it's parent training or supervision or updating and analyzing graphs and data, that's where telehealth is going to allow our BCBAs to work with more children more efficiently. And if we can do it correctly, provide enough education, take enough data to show outcomes, I think it can be a wonderful opportunity to service more children on the autism spectrum. And just a final comment to that, as we know, the autism numbers are just rising, and there's not enough of us BCBAs out there to support those unfortunate numbers.
And please don't feel like you said anything that we haven't said, in the sense that we have acknowledged that telehealth was not the best option for everybody. There were some people who didn't benefit very much from it unless we had, say, another person sitting there coaching them through it, sitting there with them. There were a lot of modifications that had to be made. It's certainly not optimal for everybody. So please don't feel like you spoke out of turn there. It's something that we all agreed on. I think anybody who thinks this through logically will. You mentioned Bobbi up in Syracuse with, I always joke about it, they have snow on the ground, 7 or 8 months out of the year up there. I did a marathon up there where it dropped 35 degrees overnight, from, I forget what it was, 60 or 70 the day before, and suddenly it was below freezing by the morning. It's like, who does that? But that's, the frozen chosen, as we call it up there. I did want to touch on this, and I want to throw it back to Bobbi Rogers. There's a certain level of empathy that you are absolutely demonstrating for the disability community, in terms of not everybody was ready for this. As you said, you really had to advocate and push for this telehealth model when other people might have said, well, we'll just shut it down until this passes. And again, in the beginning, we had no idea. We were looking at a week, 2 weeks. We're now, 10 months into 2 weeks to flatten the curve, as I've joked about on some of our other discussions. I want to throw it back to Bobbi Rogers, and I guess for you to lead into, what is your sense about how people understood this service delivery for people with disabilities? And has enough attention been paid to the disability community in terms of how this pandemic and the modifications that we've had to make for service delivery have been made?
Well, first, I just want to say that a couple of times now I've heard you say, Chanie, about how you really were steadfast in your commitment to a continuity of care. And when I think about why Proud Moments was successful, I think it was that we were really speaking to the heart of why we do what we do, and making sure that we understood the heart was families, and we are not going to let them just feel like they are alone during this time. And I felt that, I don't think there was a time where I wasn't just really proud to be a part of that endeavor for Proud Moments. It would definitely speak to, my being really proud of that in particular that, this agency offered. So first of all, thank you for that. But I would also say, and I imagine you probably felt this too, so I'd love your commentary. It was also difficult to know all the families so well and to have them in my mind and just to be wondering, are they okay? And that, Bobbi was talking about how did you ever sleep? And all of these things, made me go back to the idea of it's hard to not work when you know the families and you care so much about whether they're okay. And every time you would talk about how important continuity of care was, how important it was to make sure telehealth worked, how you made sure that educating everyone so they could do it well as part of the very first steps in bringing this to our families. I think that was the magic and why it worked for Proud Moments. But I would love your personal commentary because I have to believe you felt very similar to myself.
So focusing on the empathy and really, talking about the special needs population, I think, just really echoing to what you said, I think it's a very vulnerable population that can always use more attention. I read an article, and I would love to quote it, but I don't remember what the article was called, where the article compared providers like ours as essential workers and first responders. And we were the ventilators for our families in a time of crisis and need. And when I read that, I thought it was so true. And really being able to internalize that, no matter how big you see I tear up when I talk about it, but no matter how big our organization scales, but staying true to the mission of why we're doing what we're doing. And so many times in COVID, like it was hard. I have 3 kids who all were being homeschooled at the time, and being able to balance that and still continuing to do the work we do for the broader organization. It was tough, but really keeping it in perspective that we were these children's ventilators, and understanding that is why we do what we do gave us the perseverance, not me, but everybody in the organization, to help these kiddos succeed and really get back to face-to-face services, very, very quickly. I mean, Bobbi, I know you've heard this very often, but people often make fun that I have 3 children in Proud Moments, and they don't know which I love more. It's not that I love Proud Moments more. I feel like this is an underserviced, underprivileged population, and they need as much attention that they can get from the people that can help them.
Yes, and I've never made that joke, so don't blame me. But no, I have.
I thought you've heard it.
Yeah, I definitely have heard it. So as we now move ahead, what's next? What are you hopeful about? And if I can get into this, what scares you a little bit? What is kind of uncertain in our moving ahead as we continue through now, as the vaccines are rolling out, hopefully as restrictions are lifted, and again, as we hopefully go back to the way things were, last year. Again, we're recording this in 2021, so let's say 2019. Where are you very hopeful, and if there is anywhere, where are you a little stressed about? Where are you a little worried about?
So I always try to be hopeful. You know that, Bobbi. I try. I think that we learn from our experiences. We typically all learn from our experience, and adversity allows us to improve. And I think that happened here. I think we created a much stronger, more resilient group of individuals. It was tough. We came out better on the other side. Yes, we have a lot to deal with. There's lots of trauma with some of the families. There was abuse that went on. There was regression, but we dealt with it. We're going to continue to deal with it. And we're just going to get back on the bandwagon and, do what we do best and continuing to make a difference. So that's for the optimism part of it. What am I nervous about is that children really lost out. I mean, being home, it wasn't so much for the school. There was a lack of structure, there was more self-injurious behavior. Parents had to deal with things that they were not necessarily equipped to deal with. And being able to recover from that is going to be tough. I'm hoping that we can utilize more parent training with our providers and helping our parents get through this transition period.
Thanks. I mean, you touched on something very solid there, and something that we have discussed in prior discussions. I quoted from an article from a Behavior Analysis and Practice, the last issue, where they talked about telehealth and where they talked about how parents had been put in roles that were unreasonable and impossible. There simply wasn't enough time in the day to both work from home and homeschool and keep up on everything that they were being asked to keep up on in terms of programming. And yes, people did absolutely miss out on things. And we've talked about this in terms of even if we could keep up on some of the programming, in many cases, because of pandemic, restrictions, there was no way that we could keep up on peer socialization. It simply wasn't physically possible. It wasn't allowed. So we would be being very Pollyanna, I think, to say that there won't be any hole to dig out of here. There will be. There will be things that we definitely need to accelerate and that we'll need to spend a lot more attention on, just to try to help people to catch up and to, sort of learn from experiences that they might not otherwise have been able to have during the pandemic. So I think you're spot on in terms of that assessment. So again, Bobbi, I'm just going to throw it back to you in terms of any, again, closing comments, thoughts. Where do you see us all going here?
Well, I think just to reiterate what Chanie just said, I think we all grew from this. I think, the adversity of it was tough, but, we got to the other side of it at this point. So I just kind of want to end by saying, again, thank you for your time. And thank you for being so honest, because I think it's great when people that have the kind of influence in this field that you do are validating this for families, to have families hear your words that say, yeah, this was tough. It really does a lot in terms of the healing process for families. So I appreciate your steadfast commitment to families like myself. And I appreciate your candor today, because I think it will be healing.
Thank you for the opportunity.
Well, and thank you. It was good to hear the professional side of you this week on our COVID conversation. And again, I can't emphasize enough that one of the prevailing themes in all these conversations has been when people operate from not just a logical and academic point of view, but when their heart matches, their thoughts, and they marry those two things. Every week we get a little verklempt when we hear these conversations, because that kind of dedication has served a lot of families. And I know my family in particular, I can speak that Proud Moments was there for us and definitely saved our butts. So I'm really grateful, and love to know, that people are really in it for the right reason. So thank you again. And that completes this week. And thank you, Bobbi and Bobbi, again for our COVID conversation. And we look forward to our next talk. Thank you.
Thank you.
Thank you, Chanie. Always love working with you.
Likewise.
Bye, everyone.